Good afternoon, everyone. I'm Friesen, Minister of Health, Seniors and Active Living for the province of Manitoba. Thank you for joining me today for an important announcement. Bonjour tout le monde, bon après-midi. Merci pour m'avoir rejoint aujourd'hui pour une annonce importante. It is 1 week since the tragic situation at Maples Long-Term Care Home. Again, we send our condolences to all those who have lost a loved one in COVID-19, including all those who have lost a loved one in a long-term care facility. The entire province grieves with you at this time. Last Sunday, I sat right here in this room and committed that we would get to the bottom of what happened at Maples Long-Term Care Home in Winnipeg. Manitobans became aware in a hurry on Saturday morning that there had been a paramedic response that was significant at that home. Things had started to escalate. Patients had started to deteriorate rapidly, and it ended up taking paramedics' response to be able to stabilize a number of the residents there. One deceased, some transported to hospital, and Manitobans knew very quickly that answers were needed. Since that time, I have instructed the Winnipeg Regional Health Authority to immediately enhance the monitoring of this operator, to be more hands-on in their approach, and I can report that the WRHA now has staff on site at Maples directly overseeing the management of care at that facility. As a result of that increased level of scrutiny, new information on staffing also emerged that was deeply troubling. We have enacted that paramedic rapid response team that is providing around-the-clock quick assessment and treatment of residents at this facility and other facilities, an immediate measure by which we can enhance the care that is taking place when the signal is given that enhancement is necessary. Manitobans, remember, we have also made arrangements for the Red Cross to be at the site. Those arrangements started weeks and weeks ago. I'm pleased to say that the first Red Cross workers will be at Maples Long-Term Care Home tomorrow, providing redirection, observation, companionship to residents, some much-needed relief to healthcare workers who have been on site since the beginning of the outbreak, who are tired, who are exhausted, who need the help. And so we welcome those workers, and we think hard as well at the same time about additional steps that must be taken to enhance workforce. We have 25 outbreaks right now in Winnipeg at 38 personal care homes. And when there is an outbreak, that means that residents are sick with COVID-19, but it also means that transmission of the virus in those facilities is making workforce sick. And we have, as Manitobans know, significant numbers of workforce at a number of long-term care homes in Winnipeg who are at home, isolating or sick with COVID-19. And that, of course, puts pressure on everyone. These are the actions that we have taken immediately following last Friday evening, but there are still, of course, questions about how things got to that point and what can be done to prevent things from getting to that point again. And that is why today I am here to update Manitobans and to announce the selection of an expert advisor who will lead the review of the situation at Maples Long-Term Care Home and provide information and address the situation and provide a report to indicate how our long-term care home system can be strengthened. Aujourd'hui, j'annonce quelqu'un qui examinera la situation à la maison de soins de longue durée Maples. Cet examen fournira des recommandations immédiates. Il serait dirigé par le Dr. Lynn Stevenson. This effort will be headed up by Dr. Lynn Stevenson, former Associate Deputy Minister in the British Columbia Ministry of Health. Manitobans may remember that name because earlier this year, this same individual was asked by the Nova Scotia government to lead a review of the COVID-19 outbreak at a long-term care facility in Halifax, and that report was submitted in September. That COVID-19 outbreak at Northwood Manor in Halifax saw 360 cases of COVID-19 identified in April and May. It led to the deaths of 53 residents. And after reviewing this situation, that Northwood report made system-specific recommendations on which Nova Scotia could implement that would improve the quality of care in care homes, that would enhance protections against infectious diseases like COVID-19. I have complete confidence that Dr. Stevenson will be able to provide the answers that all Manitobans are waiting to have. Her team will have a specific timeline. This investigation will begin as early as next week. The preliminary review, a plan, will be established, and there will be a preliminary set of recommendations coming back within weeks of the commencement of this exercise, a final report to be returned only weeks thereafter. The specific timeline will ensure that timely and immediate action can be taken to address the situation in Winnipeg and in Manitoba in respect of COVID-19 and the pandemic and its impact on long-term care. So in essence, it is an engagement that will seek to look back and establish what happened. It will look forward and ask what more can be done, but it will also ask what's being done right now and what advice we can receive that would additionally strengthen the care for residents in those facilities and give confidence to their loved ones. The investigation team will look at to determine several factors. Dr. Stevenson's work will seek to establish what was the level of care being provided, what were the policies and procedures in place, what were the staffing levels, and what advice can be gained to strengthen our long-term care system in Manitoba. What transpired at Maples is devastating, and Manitobans deserve answers. With today's announcement, we are that much closer to getting those answers for Manitobans. Avec cette annonce, nous prenons des mesures pour obtenir les réponses que les Manitobans méritent. Merci tout le monde. Thank you, everyone.
Thank you, Minister. A reminder to our reporters on the line that we will have one preliminary and one follow-up question. Up first this afternoon from the Winnipeg Free Press, Danielle.
Hi, good afternoon, Minister. So what we're talking about today with this investigation led by Dr. Stevenson, so that will be looking at things that could have been done to prevent this situation at Maples and things that are, I guess, to identify what gaps exist. Why wasn't a similar consultation or report done in advance of a crisis situation in personal care homes in Manitoba?
Well, to be clear, no one has a crystal ball. COVID-19 presents challenging conditions. But let's be clear, this province has been making investments and planning in respect of long-term care since the arrival of the pandemic. That is why we took quick action to establish a process by which we would assign one worker per personal care home to prevent the unintended importation of the virus into those homes. It's why we worked very hard with the federal government and the Public Health Agency of Canada to establish and implement very strong controls on infection prevention and control. It's why we had initiatives like these visitation shelters external at personal care homes that no matter what happens with our pandemic response system, people would be able to visit. It's why we had controls in place for visitation, and even now that we do. So I would say that this is the right time for us to look into this situation further. Manitobans have questions that have arisen in respect of what happened just a week ago, and we're going to get those answers for them.
Thank you for that. Do you regret not directing on-site intervention by the WRHA earlier at Maples Personal Care Home or at Parkview Place?
I would say this, that we are all seized with the need to act We have been acting throughout this pandemic. We have used our pandemic response system to increasingly elevate the level of restrictions in Manitoba. We have been working and intervening at personal care homes. We all carry risk in every province and territory when it comes to our personal care homes. We knew that since the first wave of the epidemic. It is easy to say, well, why couldn't we prevent now a negative situation in a personal care home when we saw what happened in wave one? And yet when you look at provinces like Quebec and Ontario, even now, there are new outbreaks. There are outbreaks that are affecting residents and taking out workforce even now in a second wave. So there are no easy answers, but there are answers needed, and we are committed to getting them.
From the Brandon Sun, Michelle. From the Brandon Sun, Michelle. Okay, we'll move on from CJOB. Will. What's happened? What's happening? I understand that there is a technical difficulty. If you bear with us, Minister, we're going to reset. We ask the reporters to also please reset their lines. We've dropped the line, folks. We've dropped the line. Please hang up and reestablish. We'll get back to Michelle. Go to the slide or something for a minute, would you? Hang on, don't open anything up just yet. Let me just see if we're established on the phone. Okay. Okay, everybody back online? Okay, I don't know what happened there, but everything is dropped. So what we'll do is we'll come back to Michelle at the Brandon Sun.
Good to go.
Okay. I'll reintroduce the report. All right, folks, we're back in business. We were asking Michelle to proceed with her question from the Brandon Sun.
Hi there, good afternoon. I was just wondering, in the interim, as we wait for investigation results, are there any immediate lessons learned, immediate changes in resources that would help ensure this does not happen in the Prairie Mountain Health Region as case numbers rise?
Thank you for the question. So yes, we have taken actions. Some of them I spoke about today. Immediate actions to provide a greater level of supervision of this specific operator of a long-term care home. We actually have on-site management capability right now at 4 different care homes. To be clear, not all of this particular operator, but helping with WRHA resources, people with experience and expertise to help manage on-site, to be additional eyes and ears, helping to direct traffic, helping to establish better practices. In addition to that, of course, we have said there is that initial case investigation that happens by the long-term care group within the WRHA. We are at the same time building a task force structure that will give long-term care even greater attention at our health incident command structure. It had attention before, but we felt the need even now to elevate that governance at that table. As I said, the rapid response continues to be that kind of initial and immediate response, a paramedic-led ability to get staff to site. This has been incredibly effective thus far in preventing further deterioration of people, stabilizing them, providing acute care. One thing we heard after the Maple situation is that nurses and others on site were saying they were surprised and shocked by how quickly a chronic care management situation became an acute care situation, and that is where they can also engage and provide additional care. And then in addition to that, we will undertake this review.
Okay, thank you. Just to follow up, though, I guess the concern with Prairie Mountain Health is you have several rural homes, and I'm just wondering, how are those being shored up currently?
A good question. So what we're seeking to do, both out of this examination that will take place, this review, but also out of this immediate set of actions, is to undertake not an inspection per se, but a solicitation from a variety of long-term care providers. So in other words, we're going through the regions to those who operate personal care homes and then say, how are things going over there? Are you seeing similar conditions? How are you fixed for workforce at this point in time? How many outbreaks do you have? What do you have on site that you could marshal additional resources to? So that's a good question. We are making sure that we are fanning out, not just within Winnipeg, but across the province to stabilize and to assess the situation.
Thank you.
From CJOB, Will.
Good afternoon, Minister. Minister, Ontario was grappling with significant COVID-19 outbreaks in its care homes in spring. As early as February, care homes in Italy being overwhelmed by COVID cases, and you yourself just brought up the Nova Scotia report from earlier this year. Could our province not have avoided the situation we're currently in and the whole need for an investigation if we had just applied what we learned from the numerous other jurisdictions who went through this already?
Well, I want to be clear here that there is no one thus far who has found a way to avoid this situation. I think right now of Kennedy Lodge in Mississauga, Ontario, where just days ago reports emerged of another outbreak and 29 deaths of residents. And so Ontario, who grappled so mightily with outbreaks at their personal care homes in Wave 1, undertook to make incredible preparations, and yet somehow COVID-19 gets in. So that is not excuse making. What that is an acknowledgement of how incredibly challenging these conditions are. Infection and prevention and control, making sure that PPE is worn correctly on shift at all times, understanding the impact of having multiple residents or 2 residents per room, and whether that creates greater safety concerns for the importation or the transmission of the virus, understanding what administration or management practices are in place that could lend to further transmission. And that is why such a focus is made on cohorting. So I think at this point we say, now is the time for additional answers. If there is more to do, we're going to do it.
Okay, thank you for that. Moments ago, we were sent a statement by the Manitoba Nurses Union regarding the Bethesda Regional Health Center that's in Steinbach and a large number of COVID-19 patients arriving. So large, in fact, that the MNU is reporting nurses are triaging patients in their cars because of a lack of space in the emergency department. Have you been briefed on this, and is there a plan?
This situation is just emerging right now. I was made aware of this situation less than an hour ago. It is concerning. We know that in Steinbach, in that area of Southern Health, Santé Sud, that we have some of the highest transmission rates right now in the whole province. Some significant challenges come with that level, including hospital capacity. However, system leaders are aware. This is why we make plans, and so plans are being formed now to be able to properly address the impact of patients arriving at hospital, and plans are being made, of course, to be able to utilize that hospital's capacity and other capacity to the fullest extent possible to make everyone safe.
From the Winnipeg Sun, Josh.
Good afternoon, Minister. This is Josh Aldridge from the Winnipeg Sun. When we're looking at all these outbreaks, and I know the investigation is just starting now, where are you seeing the disconnect on some of the steps that have been taken to prevent, and the failures that you're seeing to prevent some of these outbreaks in Manitoba? Where has the issue been that you've seen so far? Is it staffing? Is it improper PPE use and transitioning in and out of PPE, as was brought up this morning? Where are you seeing those failings in the system?
So I would say that I won't prejudge the efforts of Dr. Stevenson, but you are correct in saying the things you mentioned would all be factors in the spread of the virus in long-term care homes. I'm not a medical expert myself, but I spend a lot of time with them these days, and people continue to remind me that these are our most frail patients, residents of personal care homes, some who are very elderly, some who have comorbidities, some who have, compromised immune systems. And so that's why the spread of this looks often different in a 25-year-old than it looks in a 95-year-old. So we know what the Nova Scotia report said about things like infection prevention and control. We know what it said about staffing. So we believe that, in scoping this engagement for this reviewer, we believe that this is clinical, that needs an examination, but we believe it could also be operational, and that needs an examination. So that's the direction in which we're moving.
Coming out of this investigation, I know it hasn't started yet, but I think a lot of people, beyond answers, are looking for some kind of penalty or some kind of enforcement against Rivera to come forward. Is there anything that can come out of this that would result in some kind of enforcement against Rivera, and what could that enforcement potentially look like?
Well, I would say this at this point in time. So I am fully focused on the work that needs to proceed and proceed with haste, and it will, to bring Dr. Stevenson into jurisdiction. As a matter of fact, I spoke with her only 2 hours ago. I'm so impressed that someone of this caliber will come to Manitoba at this time. Dr. Stevenson has read and reviewed this situation. She's a senior healthcare executive. She has extensive leadership experience in healthcare operations, in quality and safety, in human resources and research. She's an RN by profession. She's a PhD with a research focus on organizational change, practice, and leadership. So I think this is an individual who is high caliber, who comes at the right time. We have told Dr. Stevenson that she has full reign here, and that means that she will be able to make the recommendations that she makes, and nothing in this report, because of course it is constrained to look at Maple's long-term care home, but nothing then would preclude additional steps in future. What needs to be done will be done.
From CBC Manitoba, Jill.
Good afternoon, Minister. The physician that you've hired to review the Maple situation put out a report in September that noted the need for improving infection prevention, addressing staffing challenges with more employees for housekeeping, resident care, and so on. Did you read her report in September, and did you act on any of those recommendations?
So I have read the report of Dr. Stevenson, and just a clarification, Dr. Stevenson is a PhD nurse, so not a physician, but a PhD specialist and RN by profession. We believe qualified and ready and capable with experience to come into jurisdiction and do this work. I've read the report. I have noted the things that were flagged in that report. I won't get ahead of myself. This is Dr. Stevenson's work to take up now. But yes, the kind of themes that were addressed in those reports are the kind of things that all health ministers and all health departments and all health authorities and all operators have been dealing with since the pandemic. And as I said earlier, we have in this province worked hard, both on the front lines and by senior leaders, to really focus on infection prevention and control, getting PPE into the hands of those who need it most, making sure that our practices are in place to be able to intercept visitors into the facility and then ask them detailed questions about whether they should in fact be there. We believe that the kinds of things that we will learn in COVID-19 will not only be applicable to COVID-19, but will probably guide our practices at personal care homes long into the future.
My follow-up is we've been told ICU capacity has been reached despite Lynette Saragusa's claim to the contrary today. What will you do now?
I have no information that is in fact true, and so we continue to say that our system is built in such a way that at a time like this, we flex the capacity of the system. We continue, even right now, to be able to curtail certain procedures and surgeries in order to then allocate resources, including health human resources, to where we most need to function and most need to focus. That work is underway. Keep in mind this, just last week, we added 6 more beds in ICU than just days before that, and we will continue to add the capacity that we need. But let's be clear that right now, our hospitals are very, very busy places, and I don't want to somehow gloss over the fact that this is why we're telling people we are at a critical junction right now for COVID-19. For the few people in Manitoba who haven't been taking this seriously, you have to take it seriously now. Stay home, limit your interactions, wear a mask. We cannot afford to overwhelm our hospital capacity, and that's why it's important now more than ever for everyone to do the right thing and turn this around. I can tell you that just in the last 2 weeks, the number of people in hospital, the number of people in ICU has tripled. Clearly, we can't keep that up.
From the Canadian Press, Steve.
Minister, you mentioned the ICU beds. The occupation level today is basically the total amount that was available a week ago. They're keeping up, at the rate or maybe a little above. But how long can that continue? And do you have a plan to ramp up capacity faster than the current rate?
Yes, so actually that was part of the briefing that senior leaders, including Lynette Saragusa and Dr. Perry Gray and others from the system provided a week ago yesterday to be able to indicate how we have a 3-stage reconfiguration of our healthcare system that would, on various stages, redeploy and reconfigure itself to be able to respond to certain environmental and real-world conditions. So yes, those plans are in place and continue to be honed and redeveloped. It doesn't mean that somehow we don't have to pay careful attention to this. This is why right now, you know, Dr. Rusin always says we're in this together, and truly we are right now. I mean, right now we have ICU numbers that are very, very significant, ventilated patients significant, hospitalizations currently right now over 200. We need to settle this down, and that's why we've taken this strong action now in this red critical phase to be able to interrupt this transmission of the virus and get things back to normal and to a manageable state.
And you mentioned that most people are taking this seriously, some are not. There is an anti-mask rally planned tomorrow for Steinbach. What message do you have for those people?
Go home, stay home.
From CTV News, Josh.
Good afternoon, Minister Friesen. Josh Crabb from CTV Winnipeg. The feds today announced the Red Cross's involvement at long-term care facilities in Manitoba until January 15th. I'm just wondering if you can tell us what the scope of that response will look like here in Manitoba. We know that obviously they'll be involved in the Maples, but then what?
Sorry, Josh, could you just repeat it? I missed a bit of your question.
Just regarding the Red Cross response, the feds announced today that the Red Cross will be here until January 15th, starting at the Maples. What's the scope of the response after that? Will they be going into other care homes?
Right. And keep in mind that this becomes a bit confusing to Manitobans. We have two Red Cross responses that the government of Manitoba has engaged with. The one set of workers is actually activated to help our screening, or I should say our contact tracing. So that contact tracing complement is able to do things like daily follow-ups and you know, that contact tracing activities that are so important right now. That's important to make sure we don't get behind. The other Red Cross complement of workers is exactly the one you were referring to, that is poised to go into personal care homes. I want to make clear that that is a workforce that will add significant numbers of people to both the Maples, but other personal care homes as well. We have them able to be deployed elsewhere for some time, and that will be under continued negotiation of how long we can have access. But I would want to deliver this message today to Manitobans. We all see that an increasing number of workers at our long-term care homes are home. They are isolated. They are sick. And this is something that must be addressed. So I want to be clear. Now is the time for Manitobans to step up. If you are a healthcare worker who has been on the sidelines, maybe you're recently retired, maybe you've just resigned to do something else, maybe you were working part-time, maybe you are just contemplating getting back into the workforce, which we've made it easier to do, we need you. We need your help. We would like all Manitobans thinking about how they can assist at long-term care homes, because we continue to be concerned about the current conditions. We continue to be concerned about the fatigue of those left to do the work that others can't do because they're home. This needs to be resolved. And sorry for the long answer, but I would want to say this. All options are on the table, including our own training programs right now for additional workers, even if they're non-healthcare workers. We need a workforce, and we need it fast. And so I want to say there is a website in Manitoba called Help Next Door. If you've heard this message today and you're thinking, this could be me, I could help, I could, help redirect patients or be in their room and visit with them or empty waste baskets or deliver food. We may need you sooner rather than later. And I'm asking all Manitobans to consider stepping up right now.
Thank you for that. And on that same note, the WRHA says that in some cases, staff are being removed from their assigned facilities to help out at those facilities with a higher need. And they say there's backup plans in place to ensure that doesn't leave any sites short-staffed. But just given the amount of community spread and the number of workers that have had to isolate so far, what is the government doing to make sure that there will be a pool of trained healthcare workers who can go into facilities if the situation gets any worse.
Yeah, well, we are working at that too, and now is not the time for silos. This is not conventional delivery of health care, and so we really need to be in this with all of those partnerships with labor, with operators of hospitals, with administration. We really need people to think less in terms of silos and more in terms of global response. So I know it will come with some resistance in times if we're asking someone to go work in a different place or do something a bit different. It's not forever. It's for a short time. But we have got to make sure that we are putting our healthcare resources where they are needed most. This is not business as usual. These are very extraordinary circumstances, and we may be called upon in short order to respond in extraordinary ways.
From City News, Jonas.
Good afternoon, Minister Friesen. As I hear you discuss the staffing issues and calling on volunteers, calling on retired folks, imagine a lot of these folks are in the at-risk group, being older, folks in general. Again, I'm going to ask you about the military as an option. Have you reached out? This has been something we've heard Mayor Bowman talk about. We've heard the opposition talk about. Have you reached out to at least get a sense of how many personnel could be available?
Yes.
And as a follow-up, sir, what did you hear?
I won't comment on our ongoing engagements at the federal level, but I can tell you that I'm in regular conversation with my federal health minister counterpart, as are my colleagues. We've had meetings, myself and the Minister of Infrastructure had a meeting with Minister Blair just days ago, where we discussed the currently evolving situation in Manitoba. There are many things we need. We need workforce. We need the federal government to give us more clarity around vaccine, how we will receive it in just weeks, how we will store it, what is the federal plan for distribution. We need rapid testing devices, and with these kind of numbers, the numbers that we're putting up per 100,000 in terms of COVID positive, Manitoba needs differential access to solutions right now, and I know that our Premier continues to push on that door as well, and we will all do the same. So workforce, yes. Exceptional means to bring workforce here to Manitoba, yes. Yes to all of the above.
From CHVN, Taylor.
Hi, good afternoon. Minister Friesen, you talk about asking people to take up and step up to help out, especially when it comes to healthcare jobs. Why would someone want to do that right now when there is an outbreak going on?
Yeah. As we're Manitobans, and we need help right now, and we're all in this together. I see that you're from CHVN, and I'm reflecting right now that through the spring we had a lot of faith-based groups who stopped being able to meet together, and I know that there was many people concerned about the inability to have church. And maybe right now the question that people should be asking is, how can they be the church? And so I think for our faith-based, for our volunteer groups, we may need you more quickly than you know. We're discovering this from coast to coast to coast in Canada, that right now in everything, we need to plan for the worst even as we hope for the best, because these are challenging situations. So, there's that website called Help Next Door, and you can go onto that website and you can log on and you can register a desire to help. You can list what kind of abilities you have, but we are committed to building this index of Manitobans who are ready to step up, because we believe they're out there. We believe that they're out there, and probably they just need to be asked.
Thank you for that, Minister. Obviously, we are just at the very beginning stages talking about Dr. Stevenson's report. Do you have an idea of how long it will take for her to go through all of this?
Yeah, we had that conversation just hours ago today. This has been lightning speed engagement. We had we were able to identify some very, very capable and competent people who could come to this jurisdiction, all of whom would have brought tremendous skills and abilities and experience to bear on this assignment. On this one, it is Dr. Stevenson's view that she can hit the ground running by next week. Obviously, tremendous care will be taken in all things because we are in a pandemic situation. So we're not going to do anything that would cause there to be any importation of the virus anywhere. We will work hard. The very first thing that Dr. Stevenson said is we must respect workforce. We can't impose on them. There will be a solicitation as well for the advice of families. We want to make sure in all of this that we have some kind of portal to be able to capture the experience of families. Families out there have strong opinions. Many of them are grieving right now and asking for answers. And we're going to give them the opportunity to have their voices heard. Dr. Stevenson tells me just a few weeks to get some preliminary recommendations back, and then just a few more weeks to be able to produce a report that will help to guide us. So as I said, looking back, looking forward, and looking at conditions right now.
Thank you, Minister. We have time for just a couple more questions from our reporters on the line. Please proceed.
Minister Friesen, the Prime Minister said today that a deal had been worked out and finalized in terms of providing Red Cross support to Manitoba. Can you give us details as to how many bodies the Red Cross will provide, where they will be used?
So I'm unfamiliar with statements just made today by the Prime Minister. I can tell you that we've been working hard in jurisdiction for a few months now to be able to first launch that RFP and then to solicit back workforce. A separate engagement, as I said earlier, in respect of our contact tracing that has now brought dozens and dozens of workers here that is helping to eliminate the backlog, keep on top of contact tracing processes, even now when we're posting some very, very big numbers for daily cases. And then, of course, that separate engagement of Red Cross workforce to bring bodies here. Certainly, we welcome whatever new news might be emerging about additional workforce. We have certainly made clear to the federal government that we need strong consideration right now for whatever is available to send into jurisdiction to relieve those who are so tired at the front line. With 25 outbreaks in 38 long-term care facilities, you can imagine how this is impacting on care.
Minister Friesen, will you commit to releasing personal care home inspection reports publicly?
We have committed to be fully, transparent and open to learn and to present findings to Manitoba. We'll still decide in what way, shape, and form those findings will come back, but Manitobans will absolutely be in possession of the evidence and the recommendations that are produced by this report.
Thank you, Minister. This concludes today's media briefing.